Okay, so thanks everybody for joining in our December educational webinar all about hoof health. This month's topic was foundation formula. That was the product that we were highlighting. And we have decided going into 2018, they're going to keep the same schedule of topics because they're really, when Tina and I designed that template, the topics and the products that we were highlighting each month, they really did associate with physiological things that were going on in the horse that month or what would be going on in showing or competition. You know, summer, we're always going to talk about electrolytes. So we're going to keep that, and we're really going to try and stick to this first Thursday every month. There's a couple of times where my schedule doesn't allow that, so we'll do the second Thursday, but it'll be always on a Thursday at 10:30 a.m. Eastern Standard Time. Hopefully that's still working for everybody. If it's not, put in your feedback. We can take it into consideration, but I think it's working for most. So we will go ahead and get started. So we're going to talk about hoof health. And I think, as with every topic that we talk about, whether we're talking about digestive health or we're talking about vitamins and minerals or we're talking about coat condition, it's really important to just understand the basics of the system or the organ that you're talking about. So we're talking about the hoof. I think it's very, very important that we understand how the hoof grows and how slow the hoof grows. Because with every other product, I usually say, try it for 30 days. After 30 days, if nothing's happening, then try something else. But the hoof grows so slowly. The hoof wall grows downward at a rate of 1/4 to 3/8 of an inch per month. So we're looking at 6, 7, 8 months to get full hoof growth. So if we want to switch to something that's going to be affecting hoof health and hoof quality, you really need to stick with it for that length of time to see any improvements. If somebody starts the foundation formula and after 30 days they're like, well, my horse's feet are still terrible, I'm going to try something else. Well, that's just not a realistic amount of time to see any changes in the hoof. There are a lot of different factors that affect the hoof. Things like nutrition, the breed of the horse, the age of the horse. As with all animals and people, there's a lot more growth that occurs in younger animals. The season of the year, all things influence the rate of growth. Environmental conditions, which really associate with season as well. If it's very wet, if it's very dry. We know the breed, for example. Thoroughbreds, the American Thoroughbred, has been bred for speed, and there are other genetic characteristics that have gone by the wayside when we selected so intensely for one trait. We've selected intensely for qualities that improve speed in that horse, and unfortunately what has become what's kind of fallen by the wayside is hoof quality. So that's something that genetically we have bred into those thoroughbreds. So we really need to take care of the nutrition of the horse. We start with water because it's absolutely critical to the survival of the animal. In people, you can use kind of the 3-3-3 rule. You can survive without oxygen for 3 minutes, without water for 3 days, and without food for 3 weeks. But horses are super, super sensitive to dehydration, even more so than people. And as we go into the wintertime, we have to be very cognizant of the amount of water that horses are drinking. I know it's difficult if you've got automatic waterers. If you struggle to know how much your horse is drinking, then put a bucket, turn the water off or put a piece of board over it and clamp it on it and put water buckets in the stall and see how much they're drinking. they should be still drinking about 10 to 12 gallons of water in cooler weather, but that doubles in hot weather. And if your horse is not drinking enough water, one of the first things that you'll notice is dried out feet. Obviously, that requirement for water increases with lactation and heat and exercise, but they will also, if you're trying to encourage your horse to drink water, number one, add forage to the diet, because when you add about a pound of hay, that will encourage them to drink between a quarter and a half a gallon of water. I am never a proponent of just adding salt to the feed, except for in cases where I'm really trying to force the issue of water intake. So if the horse has kidney or liver failure and I want to really force them to drink water, or I notice that they're not drinking enough water, then I'll give them ad lib salt as a salt block, but I will also put one tablespoon of salt per feeding, per meal, into their feed. So how does water have a role in the hoof? So the cellular functions rely on adequate tissue hydration. The blood flow in parts of the hoof, that's how nutrients are delivered. Adequate hoof moisture is responsible for hoof strength, elasticity, and function. It's amazing. When I was a kid, there is a veterinarian in Australia called Dr. Chris Pollitt, and a lot of people are familiar with his work, but he is a real leader in hoof health and hoof quality, and has done more recent research and a lot of laminitis research. But I remember watching videos that he had created where he had taken a cadaver leg from, say, the knee down, and he had sliced it in half, and he set it up in this hydraulic contraption that really simulated leg movement and pressure, and videoed the leg and the hoof as the horse was galloping. It is absolutely phenomenal the amount of expansion the hoof has when the horse puts its foot down on the ground, and all that pressure from its weight is pressing on the hoof. That's why we never shoe to the edge, all the way to the edge of the hoof, because to the edge of the shoe, because you need room for expansion. You look at the hoof and you think that's a really hard structure that has no movement or flexibility, but it's amazing how flexible that structure is for being how hard it is. Always remember, the hoof is just hard hair, and so there really is, and it's made up of all of these tiny strands that kind of make that hoof capsule. And I've got some pretty neat pictures as we go forward, but just remember, the hoof is a living part of the horse. It's got a lot of flexibility, and moisture is really, really critical. And the moisture content of the hoof wall comes from internal sources, so about 80% from the water that they drink, and about 20% from external sources. So again, tidbits from when I was growing up in Australia, where it was very, very dry certain times of the year, and before the farrier would come, he would actually have us, we had sand in the stalls, and I would soak the sand, with water, and I would let the horses stand in there for a few hours before he came, in order to help hydrate that foot. Otherwise, it was just way too hard for him to shoe. So really important, keep the horses drinking. If they're exercising a lot, making sure that they're drinking plenty of water, adding electrolytes. We've all probably seen hoofs like this. Neglect and excessive drying, whether it be from a really dry environment and they're not drinking a lot of water, you're going to see these really dry hooves. They're shaling away, and then some of this can also become part of poor nutrition, but you can see cracks forming, so we really want to avoid that. Also, we see a lot of this if you have massive swings in the soil content, the moisture content of the soil. So if they're living in a really muddy environment and then it goes really dry, or you move them and it's a really moist environment to a dry environment. So take into consideration, you want to keep your stalls dry. Really don't want them standing around in mud, because all of this can affect their hooves. Protein. Well, how's protein got anything to do with this hard hoof? Well, protein is making up the hair, which is really making up the hoof. So proteins really are broken down into these organic structures called amino acids. The building blocks of protein are called amino acids. Most adult horses actually only require about 8 to 10% protein in the total ration. Now, don't be looking at your bag of feed and think, oh, it's got 14% protein in it. This is too high for my horse. Most local grass hays these days run around 6 to 7% protein. So I'm talking about the total diet has to be about 8 to 10%, though. It's hay, grain, everything included. Lactating mares and growing foals need higher protein because not only do they need protein for just basic maintenance, hoof quality, muscle, blah, 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 these lactating mares are putting a lot of extra protein into their milk, and the foals are doing excessive amounts of growing. Structural proteins make up muscles and tissues like hoof tissue. And there are these functional proteins that help with enzymes. There are certain amino acids that we consider essential, like lysine, which means anytime somebody uses the term essential correctly, it means that the body cannot make them or synthesize them, but they must be supplied in the diet. So lysine is an essential amino acid, and it must be supplied in the horse's diet because there's no way in the body can they make it. Unlike biotin, for example, biotin is actually not an essential nutrient. The bacteria in the hindgut of the horse make biotin. That's why if you ever hear me talk about hoof supplements, I'm not as enthused about a straight biotin supplement as I am about making sure we've got a supplement that's got some biotin, but has also got good quality protein and other minerals that are also important. Because if we have the digestive system functioning properly on that horse, and they're getting a digestive supplement and the bacteria in the hindgut are working fine, that horse is never going to be deficient in biotin. So if we get back to protein, though, being an essential amino acid, the lysine, where are we going to get this from in the diet? Well, legumes, soybean meal, for example, alfalfa, these are going to be high in those amino acids like lysine. But your cereal grains and your grass hays are not that high in amino acids. So if we're feeding a young growing horse, then just a grass hay and cereal grain is not going to cut it. You really need to add in some soybean meal or some alfalfa. But our mature horses, grass and oats would be fine, and they're going to get enough protein out of that. The hoof is mostly made up of protein and moisture. Dermal tissue of the hoof wall rely on protein to provide structure, strength, and function. Epidermal cells, so internal cells, produce 3 protein groups. You know, if any of the ladies out there, we've heard the term keratin before. We think about hair. Well, remember, hoof is just hard hair, just like your fingernails are just hard hair. So keratin-associated protein, and these cell envelope proteins, these are all protein groups that are important in the hoof. So adequate amino acids are absolutely critical to hoof strength. Now let's talk about minerals. Minerals, they're needed in very small amounts compared to the fluids, but they have a function in everything. Body structure, fluid balance, nerve conduction, muscle conduction, immune function. When we're talking about body structure, we're talking about muscles, skin, hoof, connective tissue. So which minerals are going to be important? Well, calcium, phosphorus, sodium, chloride, magnesium, potassium, sulfur, iron, manganese, zinc, copper, cobalt, iodine, selenium, chromium. They're all important. Fluoride, all important for hoof quality, some more than others. Copper, zinc, these are really critical in the hoof quality. Zinc especially. Now, this gets us to mineral nutrition. More mineral isn't always better. We talk about chelated minerals a lot and how chelated minerals are more bioavailable to the horse, but not all chelated minerals are the same either. Chelation really just means that it's attached to something. And what sets different types of chelated minerals apart is what are they attached to. Certain things that you attach these proteins to are going to be more beneficial to the horse. So Andy, for example, recently asked me about a vitamin and mineral supplement that had chelated minerals in it, but what those minerals were attached to was a polysaccharide complex, so a carbohydrate complex. What that's going to do, that's going to encapsulate that mineral, keep it safe, but it isn't going to help it be more absorbed in the animal. It's going to make sure that it gets through the stomach and into the small intestine where it needs to be, but it's not going to open up more doors. So what we think, when we think about chelated minerals, horses are meant to eat plants, not rocks, right? So in the wild, horses eat grass. Those grass have roots that go into the ground, absorb minerals, because all minerals are just dirt. They come up into the plant. The horse eats the plant, and those minerals are in the leaves and stems in their organic form. That's how the horse is meant to eat them. They're very bioavailable. But we know that our soils are very deficient. Some soils are very acidic. And when the soil is acidic, it doesn't matter how much mineral is in it. It actually binds it up, and it's not going to be in the plant. So doing a soil test is not always an accurate representation of what's in the plant. And so what we want to do is we want to mimic that grazing and how horses would see those minerals. So we want to attach those rock-type minerals to a carrier. We want to chelate these minerals, but it's very important what carrier we use, because not only will that carrier keep that mineral safe, because what you can see from this diagram here is there's so much competition between minerals. And so we want to make sure that the minerals that we're feeding aren't getting bound up by other minerals, but they're actually being used by the horse. So they're being encapsulated by that chelation agent. We use proteins, proteinates, and we encapsulate those minerals with this protein. Not only does it keep them safe, but it also, now when we're trying to absorb across the intestinal wall, we're not just opening the mineral doors to go across the intestinal barrier, but we're also opening the protein doors. So we've got a ton of different doors that we're opening so that these minerals are much more readily available to the horse. Something that's in a polysaccharide encapsulator, the horse isn't really meant to eat a lot of carbohydrates. So it doesn't open a lot more doors for the horse. I hope that you understand my analogy there on minerals. So calcium, for example, it signals the formation of a very rigid cell envelope. Really what that means is that final hardening of the hoof, cornification. Calcium is involved in that. Zinc is extremely important in the epidermal, so internal and dermal cells. Blood vessels require zinc for cell reproduction, maintenance, repair. Also collagen, keratin-associated proteins. All the strength and flexibility really comes down to zinc. So zinc is really, really important. Copper, involved in connective tissue, structural integrity, rigidity of the outer hoof wall. Manganese, internal structure of the hoof, maintenance and repair of joint cartilage. Selenium also is going to help protect cells from damage. Vitamins, they're essential also for growth. Fat-soluble vitamins are A, D, E, and K, which means if your horse is on a really low-fat diet or is thin, you need to add fat to the diet to enhance absorption of these vitamins. and also water-soluble vitamins, which is our B vitamins, which there's, 8 or 9 of those, biotin being one of them, and vitamin C. Vitamin D comes from sunshine. If your horse is stuck in a stall due to injury or, just the training methods, then maybe a supplement with added vitamin D will be good. But vitamin A and vitamin E, which are important too, they're lost in hay, and most horses aren't getting enough grass. About 10 to 14 days, it's pretty much all gone from hay. But that B group vitamins are synthesized by the microbes in the hindgut. So whilst biotin is important to have in your hoof supplement, it's not the only thing to have in your hoof supplement. Biotin is going to help with hoof strength, that hoof wall to connective tissue connection, and vitamin A is really important in epithelial tissue. So the hoof capsule, this outside thing. What's working here? And we'll work our way down into the hoof. Well, we need water, we need energy, we need protein, calcium, zinc, manganese, copper, selenium, vitamin E, and biotin are all important for the outer hoof structure, the hoof capsule. Now we're getting in closer. We're getting into the dermis. We've taken away that hoof capsule. Now we're in the next layer down, the dermis. I'm just trying to find where that noise is coming from. And water and energy and protein and zinc and manganese and copper and selenium and vitamin E and vitamin C are important when we get to that next level down. Oops. So now we're at the central core of the hoof, the bone, and energy and protein, calcium, phosphorus, zinc, manganese, copper, vitamin D, and vitamin A are really important for this internal structure here. So balanced nutrients in adequate amounts will help build the hoof from the inside out. Everything's from the inside out. I don't want to band-aid it by wiping paste on the hoof capsule, thinking that I'm really helping the horse. I want to feed hoof health from the inside out. So we're going to build it up from the inside out. So these problems, these dry, cracked hooves, result of a lack of moisture. Growth rings. Sometimes you'll see these rings, these ridges on the hoof wall, and that is usually just any significant change in the animal's life. Could be a significant change in nutrition. You've rescued a horse. You take horses from a rescue situation where they're malnourished and thin, and you start feeding them and get them healthy, I guarantee you will see that growth ring, that stress ring. A change in the environment. Now, we got a lot of horses going through a lot of stress out there in California with all of these fires. That's immense stress on these animals. Animals that survive, I guarantee you will see these stress or growth rings. Or any other kind of disease. Laminitis, we see these rings. Laminitis, well, there's 1,001 different causes for laminitis, which just goes to show laminitis is really just inflammation of the laminae. And I want to go back here because these little things here, you can kind of see down here, it looks like the gills in a mushroom. They are the little laminae, and on the inside of the hoof, so the inside of this hoof capsule, there's identical little laminae, and we're holding that structure together. So laminitis is just inflammation of those laminae, and anything that affects the horse ends up affecting the hoof. And that just goes to show the amount of blood flow going through the body and the amount of blood flow that ends up going into the hoof. The hoof is just a sensor for every bad thing that goes on in the body. So we look at this graph, this lush pasture is one of the main causes for laminitis, grain overload. There are other unknown causes, but dietary causes make up about 50% of the causes of laminitis. It's, as I said, it's inflammation of those laminae. The laminae is the soft tissue between the hoof wall and the bone. The laminae are responsible for attaching the coffin bone, so that bone that we saw, to the hoof wall to stop the bone from just falling through the sole of the horse's foot. So right in here we've got all these laminae. So this here is holding that onto that, right? Inflammation is just damages to that laminae, unable to hold that coffin bone in position, and as we get rotation downwards, that's because those laminae are losing their stability and their strength, and that coffin bone starts to rotate down. So you can see in radiographic view, this on the left-hand side is nice, but you can see on the right-hand side that coffin bone has nothing holding it in place, and it just starts to sink downward. Typical stance, horses with laminitis, is they're leaning back, they're trying to get that pain off. They really difficult to go in a circle. There's a strong digital pulse, so you take the pulse down here in the hoof, there's a very strong pulse there because there's a lot of inflammation. Where there's inflammation, a lot of blood goes because that blood is there trying to get rid of the whatever is causing the issue. And there's also a lot of heat in those hooves, so putting the horse's hooves in ice water is important. As we mentioned, as a result of many different disease conditions, risk factors include carbohydrate overload, colic, diarrhea, any disruption in the gut. Retained placenta causes toxicity, drug reactions, systemic infection, all these things. Mechanical, we've seen in some of our race horses, they break one leg, they're taking all the weight off that leg, and they get laminitis in the other leg because it's mechanical. Cushing's disease, these horses have a higher tendency to get laminitis. That spring and autumn posture, insulin resistance, obesity, genetics, frosted grass, sudden changes in diet, all of these things. The list is on and on and on. So if you want to prevent it, so we're going to control these nutritional factors. We're not going to let these horses get fat. We don't want to overload the diet with carbohydrates. Feeding a digestive supplement to avoid colic and diarrhea. Obviously, sometimes we can't help the systemic infection, but indirectly trying to really keep that immune system strong so they can fight off infection. Horses that are more predisposed, so fat horses or horses in the pony breeds or wild Mustang breeds, they keep them off that spring or fall pasture, avoiding dietary changes. The other thing that's really important, and I think this just stems to overall hoof quality, because you look at this horse, look at the tiny, tiny little feet that carry this massive animal. You got 1,100, 1,500 pounds on 4 tiny little feet. So body condition score is really important, and we don't go over it that often. I just say, people familiar with body condition scoring system. So I want to go through it in a little bit more detail. 1 to 9 scoring system, 1 being really skinny and 9 being super fat. And we kind of score all of these areas. So this horse is a 1, super emaciated from the hind quarter. He's also going to be depressed, this horse is not going to be happy. He'll be really sick, depressed. He'll probably have discharge out of the nose and the eyes as well. At 2, you can see when you run your hands over the horse that we've still got bony features sticking out, and you can still clearly see the ribs, but compared to this horse, he's got more coverage. A 3, we're starting to now get more even coverage over the hind quarter. He's still got a bit of a U-neck, and I can still clearly see the ribs. A 4. Now on a 4, I can still see the ribs. I don't have to press hard, but the rest of the horse's body is getting some even coverage. Now I see a lot of event horses or endurance horses that will go anywhere between, be in peak condition anywhere between 4 and a 5. A 5, this is a 5. This is the beginning of ideal. This and this, these are 2 ideal. Whoopsie, we've got to go back. Shoot, how am I going back here? 5, so we've got even coverage. I don't see the ribs, but I don't press hard to feel them. I don't have a big U-neck. Even coverage, no big fat deposits anywhere. And a 6, again, we start to get a bit more fat coverage. 7, now this is getting to overweight. 8, again, more overweight. You can just clearly see these horses have much more fat on them. And a 9. Now, this is gross. Never get your horse like this. This is dangerous. And I guarantee this horse, especially with his big crest, is going to be at risk for laminitis. CRESTY neck scoring system. This is important because it The body condition tells you kind of overall body condition, but it doesn't tell you really its indicator for risk factors for laminitis. That really comes from this crest here. And so there's a lot of ponies out there or fat horses that don't have a crest, and I'm not so worried about those horses. These horses with the crest, they're the ones that I'm worried about. This is a scale of 0 to 5. So a 0, we're going to associate this with a body condition score of 1 or 2. No crest. Number 1, we have no visual appearance of a crest, but it's pretty flat there. There's slight filling when you start to squeeze it. A 2, we start to get a little bit of a crest, a little bit, but still everything's nice and even. A 3, now we are starting to get more crest, but this is still completely safe. Now a 4 and a 5 here, this is dangerous. And a 5, very dangerous, right? So we don't want these animals to get to a 4 or a 5 because at this point they have much higher likelihood of developing laminitis, which is going to really mess up the hooves. I know this seems like, why are we going to talk about obesity and throwing in this? But we're talking about hooves, and laminitis is one of the biggest things that affects the hooves. And so I just want to show you how easy it is to get a horse fat, or to take a horse that's borderline fat and make him obese. A lot of people would use senior feeds because, my horse needs to eat something, and I'm just going to throw him a pound of senior feed a day. And I worked out, based on the amount of energy or calories in a pound of senior feed a day, which is probably about 2 handfuls a day, you're going to gain a whole condition score over 365 days of doing that. So be very, very careful with these overweight horses, what you're just throwing to them. So how are we going to feed? Let's say we got a 10-year-old Morgan mare. She's 1,000 pounds. She's got advanced laminitis. She's on pain meds. She maintains her weight well on grass hay. So what are we doing? What are we feeding this mare? Well, we want to maximize forage. We want to minimize the amount of sugars and starches. So maybe get your hay tested or soak it. We need to make sure she's getting proper vitamins and minerals because the hoof is damaged. We need to fix the hoof. You saw how vitamins and minerals were so critical in every aspect of the hoof. So you need to make sure that while we're taking away a lot of the feed that's giving a lot of carbohydrates, that we're supporting the vitamins and minerals. So the DAC orange, for example, really, really critical. Maintain weight or slightly below optimum. If they're really thin, you need to feed them fat for weight gain. And the hoof supplement is going to help repair that tissue. And I've got a question mark there because along with good trace minerals and vitamins, so along with your DAC orange, this is going to be really most critical. Whoops. Okay, so now what I'm going to do is I'm going to bring over another thing for us to look at. Oh, get out of here. Sorry, I'm just talking to myself. Oh, sorry. My computer is acting up, so you just bear with me here. Get out. I'm going to close that. And you don't see my screen there. I'm going to bring this. Nothing's working for me right now. Hang on. Okay. So, I'm looking at what you can see now. Perfect. You're seeing my ration balancing program. Sorry that took a few minutes to get to, but I want to show you. So a lot of times we say you're going to feed the DAC products and oats and hay, and that can be a balanced diet, and absolutely it can. But what if we have a laminitic horse or a horse with hoof problems where we want to keep the carbohydrates down? We found a hay that's low in carbohydrates, but we can't feed oats because they're high in carbohydrates. So what are we going to do? So I want to show you balancing a diet using beet pulp, wet beet pulp, and hay, and your DAC products on top instead of oats. So let's take that maintenance horse. He's 1,000 pounds. Let's say he's 10 years old. And what are we going to add to the diet? We're going to put in some grass hay. I'm going to give him about 15 pounds. Okay. We're going to add some beet pulp. So max at, 1 to 2 pounds. It puts 2 pounds. That's dry. We're going to wet it. That'll be about 4 pounds of wet beet pulp. Okay. I'm going to add our supplements here. We're going to put in a bit of DDA. We're going to put in 2 scoops of that. Go down here and we're going to put in 6, a scoop of foundation formula, add ingredient, and we're going to put in our DAC orange. I'm going to put in 2 scoops of DAC orange. Look at that. Look at that awesome diet. So what you are seeing here is that what we had to orient yourself to this table here. I don't think I can make it any bigger for you. Energy, protein, calcium, phosphorus, copper, zinc, selenium, manganese, iodine, lysine, vitamin A, and vitamin E along the bottom. The goal with this chart is that all of the bars are going to touch that red line there, which is meaning this horse is getting 100% of each of those requirements, all of those nutrients. And you can see by feeding beet pulp, hay, and adding your supplements, your diet is balanced. Now, I've got a little less energy than needed, but that's okay because maybe you want this horse to lose a little weight. Put in a little bit of oil and you're going to meet the energy requirements, or just feed a little bit more hay. So I wanted to show you that you can balance a diet using beet pulp, hay, and your DAC products, right? Okay, so that is the end, and now I'm going to open it up for questions. I'm going to unmute everybody, so hopefully people aren't having the radio on in the background or something. Wow, everybody's nice and quiet, because a lot of you have got yourselves muted as well. So, questions? Everett says, awesome. Thank you, Everett. Oh, by the way, Everett turned 30 yesterday. Happy birthday to you. Happy birthday to you. Happy birthday, dear Everett. Happy birthday to you. And you know what he did on his birthday? He did a meeting for his dad.
With him.
With him. So that's pretty cool. Okay. Nobody seems to have any questions. Some feed biotin and lysine separately in addition to orange. Is that needed? If you're feeding foundation formula and you're feeding good hay, no. But if you're not feeding either of those, then sure, you might have to add biotin and lysine. But I don't like to add multiple different things. I like to keep it all together. I really don't like mixing. I don't like when I work with my feed companies, I don't like people to feed a little bit of Purina and a little bit of Nutrina and a little bit of Southern States. I like you to stay within one company. And the same when you're doing your supplements. Our supplements are designed to complement each other. So when you feed the DAC orange, you feed the foundation formula, they complement each other and they're not competing with each other. So just a little food for thought. Okay, people think it was useful. That's excellent. How would road horses' hooves be impacted in addition to condition? Can you elaborate a little, Everett? We're talking about buggy horses, I'm assuming. Yes. And all of that mechanical stress on those hooves. Another thing that so with these buggy horses that are pounding down the pavement and there's a lot of wear and tear on those hooves, we need to make sure we keep those hooves strong, but we need to keep them flexible as well. So hydration, strength, really important. But there's also a lot of inflammation that can wreak havoc in the hoof. So the yucca or the DHA Perform added in will decrease inflammation that will also go towards the damage of that hoof. So that's another thing they would add to horses that are working on hard surfaces regularly, is some kind of anti-inflammatory, be it the yucca or the DHA perform.
Okay. Yep, that's good.
Perfect.